So today's case discussion will start with this case of a young patient presented with lower abdominal pain. بس شوف جيبي هذا الكرسي احسن على مود الماوس. اوكي خلينا المكان هنا هاج. So CT was requested. يلا قلبي هو دا يروح يا جماعة ليش صوت اوكي So this is CT of the abdomen and pelvis طبعا, showing with or without contrast.
With contrast.
What kind of contrast, oral or IV?
IV contrast.
Okay, oral or لا؟
اكو oral.
So it's oral and IV. زين.
Liver normal.
Okay.
Pancreas normal.
Ultrasound was normal, by the way, for this case.
Adrenal normal.
وين الادرينال؟
Left.
اشري عليها بالماوس.
هاي هو adrenal.
هاي ادرينال. هنا تجي الادرينال. بابا. الادرينال above the kidney, مو below the kidney. This is the adrenal. Good. وين الأذر أدرينال؟
superior.
إيه ندري superior بس وين؟ تمام؟ يلا كملي.
Kidney normal.
So till now everything looks good.
Kidney normal.
What's the cause of this guy's pain? اصبري ريهان.
بشوف abnormal thickening of the wall.
Of what? What wall?
السيكم.
Good.
thickening بالwall وماخذ enhancement wall.
هذا السيكم؟
لا الكدني مو نزل بالجو. لا كدني.
Oh, but this is a kidney. ليش هيك نازل لي جوا؟ Why it's inferior to normal? What's wrong with this kidney? This kidney is اوقفي لا تحركي الماوس. This kidney is low lying and malrotated. Okay? It's not pelvic, it's low lying, sometimes called ptotic kidney with a P, ptotic. Okay? زين نرجع للإكزيال. هاي أول شغلة خلصناها. كملي. الحاد الآن ما تشوفين أي شيء abnormal. Good. Rihan, what's the cause of this guy's pain?
Appendix, I think, was dilated somewhat.
وين الأبندكس زينب؟ هاي الابندكس.
No,
زين التيرمينال اليوم وينه؟
the posterior.
دقيقة بابا دقيقة بس. التيرمينال اليوم وين والابندكس وين؟ So first of all, this is the terminal ileum joining the cecum. Okay? What's this here?
Okay.
How to know its appendix? Follow it up. It should connect
Find it.
blind-ended structure. اوقفي لا تحركي الماوس. شوفي هسه هذا connected هنا. If you follow it and you can see it here. تشوفين؟ زين. هاي ايش قد الدايمتر مالتها؟ It's a 1 cm diameter. ال surrounding fat planes شلونها؟ شوفي هنا. There is stranding, there is edema of the surrounding fat planes, okay? And if you look carefully, you can see some lymph nodes also, like this one. These are lymph nodes here, okay? So all of this is in favor of what? Appendicitis. Why the ultrasound was normal? It's a retrocecal imposition. So that's why it could not be seen by ultrasound.
We can't change it position of patient.
Sure, but
Lateral.
in this case it did not work. We tried everything, we could not see it. So CT was recommended and it showed evidence of appendicitis. As simple as that.
I think we should wait also because all contrast is not entering.
Yeah,
Okay.
more till it reaches the colon, it needs a long time. First, second, you don't know when it will reach the colon.
Yeah.
Maybe after an hour, maybe after 4 hours.
So
You have just a standard time, and then you do the imaging and see what's going on. Okay?
But the contrast not reaching the tip, that's appendicitis.
Sorry.
The contrast should reach the tip of the appendix to exclude appendicitis.
Well, in this case, even if it's without contrast, I would consider it appendicitis. تمام؟ Okay, good job. Let's see. يلا فتشي قاعد بس قاعد هناك كنت شو اسمه؟ بس اريد فتشي ثقيل. اوكي.
CT finding of perforated appendicitis.
نفس same thing but with extra luminal gas and most likely there will be some kind of a collection somewhere.
Sometimes we cannot see appendix by itself.
اي طبعا تكون inflammatory mass يعني تصير appendico mass شو اسمه whatever you call it appendicular mass. زين خلينا نشوف ايش عندنا نقول فد شيء يليق بك.
لا
افتح ابوي زين. وينها case هي simple بس very interesting of a 201. I will not give you a history about this case. You should figure it out. It's a young 26-year-old female patient, okay, with a CT scan. Let's start. Abdominal pain. So, what's going on here? Just go ahead. Lung
There
window.
is gas here
Okay.
around border there.
Okay. You can't change into lung window. Just let me.
There is also gas anterior to the diaphragm
Good.
here.
So there is extra luminal gas.
Yes.
تمام. من وين جاي؟
It's not retroperitoneal, it's intraperitoneal.
اوكي not retroperitoneal. نرجع لللانج ويندو للسوفت تشو ويندو سوري.
The most common cause should be peptic ulcer. or
Peptic ulcer is a common cause.
The most common one.
اوكي.
Gastric,
زين. يقول لك اي كمل.
Here, I don't know if it's from
There
duodenum.
are some pockets of free air.
Around duodenum there
Yeah.
is.
يقول لك there are two things the radiologist miss. شنو هما؟ What are they?
There's stitch here.
There are two things the radiologist commonly miss. The very small and the very large.
And this is post op.
Some sort of intervention.
Here.
Okay.
What is this?
What is this? يعني انت هذا المضوجج بس؟
If it's
Maybe she
surgery-
swallowed
if
something.
it's surgery. Yeah.
Okay. Rehan. Where is the stomach?
It's dilated.
When dilated? When?
This one.
Normally we see the stomach like this, rounded. Please keep quiet, Rajan.
It's a very round shape.
This is very round shape.
Yeah. But continuous with the duodenum.
So,
Diverticulum.
diverticulum. You have a distended diverticulum.
But
Zin.
the stomach or that one.
Let's see other windows. Maybe help us with something. Let's see what kind of window we have. Maybe this one. Try. Does it help? Then let's go to coronal.
Where's gastric junction? I cannot see.
You never have a stomach shaped like a ball.
No.
There is what in the stomach? Guys, ايش بيكم؟ مو هسه تجون ونشوف العضلات. لو بس من ورا نشمر حكي. هسه ورا ما نخلص، خلصوا ونسلي براحتك. ها؟ Gastric what? Gastric balloon. Okay? It's a kind of weight reducing surgery. زين السؤال هنا sorry. السؤال هنا gastric balloon inserted laparoscopically or how do they insert it?
Endoscopically.
Endoscopically. So endoscopically there is no opening the skin. Why there is free intraperitoneal air? ها طبعا the patient refused to take oral contrast by the way يعني. Why there is free air?
Perforation.
It's a very rare complication of endoscopy, which is perforation, because you have no opening of the skin. It's
Well,
endoscopic.
they're putting balloon there.
The balloon
Perforate.
during the insertion of the balloon or post, the patient
What
had a
about this
perforation. البالون be valve. Okay, so the air within the balloon is normal because they inflate the balloon with fluid and some gas gets in. But the air outside, which you catched, which is a good catch because no one would think of seeing the lung window, is it due to what? Or bone window even is due to perforation of the stomach, which is very unexpected in balloon endoscopic insertion, and the case was open, and there was a perforation, and it was sutured, and the balloon removed. She didn't drink oral contrast, so it's very difficult to detect the place. Without oral contrast, you don't know where is the site of the leak. حتى والcontrast ممكن يكون difficult. Okay, so it's a post-surgical or post-intervention. It's not surgical. Post-endoscopic balloon insertion, gastric perforation. Post-surgical until 7 up to 21 days. على شرط إنه every scan it's less in amount. If it is the same or increasing, it's not normal. Okay, so nice case, good job. قول عيني.
So I have two questions.
قول.
If there's any new mobilia for the space, and another question: what it is safe to give contrast in perforation or a contrast?
طبعا safe. You don't give barium. In CT scan, we give water soluble. You give water soluble اللي هو الأومني بيك وجماعته. Diluted. نفس ال IV, we dilute it in water and we give it to the patient to drink it. It's safe because it's already leaking. يعني هو patient leaking. Barium, you use it for barium studies. You don't. If there is any suspicion of any perforation, barium is absolutely contraindicated. في كل modalities, any suspicion, you never give barium. Because if there is a leak, you will end up with massive granulomatosis in the peritoneum, and it's a very bad thing. يعني. Okay? New mobilia, this is the liver. Do you see any air within the biliary tree? This is around the hilum and things like that. Not in the liver. New mobilia, to get it, you need to have some abnormality at the sphincter of Oddi. For example, sphincterotomy. To get pneumobilia, as long as sphincter of Oddi is working, you don't have, our patient doesn't have pneumobilia. احنا ما نقدر هنا نشوف البرفوريشن لانه البالون يعني filling the stomach. You don't know where it is exactly. You might try to give some oral to see the oral contrast from where it's leaking. At least you see if it's collected anteriorly, posteriorly. You give us a clue. But to have extraluminal air in a patient with no surgery, definitely there is some kind of a perforation. Without the balloon, most likely perforated DU, مثل ما قالت الدكتورة ريهام. It's the most common cause. But she's young, she has no history of ulcer disease, peptic ulcer disease. So this possibility is out of the way. Recent intervention by inserting balloon, it will be the most likely thing. Yvonne, قلت عندي سؤال؟ جربين؟ يلا تعال خلينا نشوف سهل لو صعب. شلون يعني؟ هو البالون الغاية من عند الهد. The aim of the balloon is to distend the stomach so that any small amount of food will make the stomach full and the patient stop eating or reduce eating. فthe trick إنه البالون is filling the stomach, maybe a little bit overfull in this case, okay, but you know girls these days, they just want to get thinner no matter, and she's not very obese by the way, she's yes iatrogenic طبعا. زين شو تريدين CNS GIT pick your poison يسوي رياضية شو عندي زين اتخيل بعد شو تريد زين خلينا نشوف سهلة هاي 207
يمكن بالنسبة لي صعبة.
لا سهلة زين This is a CT scan of a female patient, I think. I'm not so sure. Okay, like 60 years old, something like that. CT abdomen and pelvis with oral and IV. She's having some abdominal discomfort and things like that.
60
60.
شازة
لا no,
chest.
chest.
Yes.
60. So, this is the native.
Yes, this is native.
Okay,
CT of upper abdomen. CT of abdomen.
abdomen.
Axial view.
First of all, what's this dense thing here?
This
Huh?
maybe stent of operation of cholecystectomy.
Cholecystectomy clips,
Yes,
not stent.
yes.
Clips.
Yes.
Leave it. هذا هيك انتهينا من مسوي cholecystectomy قديما. No.
Yes.
احكي ايش تفكرين؟ قولي لنا.
I'm thinking of there is air.
باي مو على مود ذيك الكيس كانت بها اير. لازم كل الكيسز بها اير.
There is
كيف؟
a faint shadow here.
First of all,
Yes.
this is without contrast.
Without contrast.
In order to confirm, you need a contrast. Okay?
Yes, I'm asking to give me contrast.
You can ask,
Yes.
or you can just
Yes.
pull it and see.
I'm still not coming down.
Hi. Second, you take a quick look from up to down, and then you decide where to focus. Because you don't, the abnormality might be down. You don't know.
There is a hyperdense lesion at the left side of colon.
What about oral contrast? Possible?
This is not contrast.
No, it is contrast in the small bowel.
What?
Oral contrast,
Oral contrast, yes.
not dense lesion.
Yes.
زين انزلي هذا شفناه كله. انزلي خلينا نشوف اللي ما شفنا. زين كملي للأخير. زين. So now we've seen the oral contrast, the native without IV contrast. Let's see the venous phase. Let's skip to the venous phase. This is a
Hypodense lesion.
what kind? What do you think this is?
Simple cyst.
This is a cyst within the liver. It's of no significance. There are
Yes.
another one here, another one there, few cysts.
That was I'm thinking from this region.
These are the portal triad.
cyst.
What about the kidney, right and left? Is there hydronephrosis?
Hydronephrosis of
No.
the right kidney,
No,
Not
never.
hydronephrosis. This is
Whenever you see this appearance is just few parapelvic cysts
cysts.
that simulate hydronephrosis. There is
this is
how to
hyd-
confirm. Just make a delay image, and you will see that the contrast.
hydronephrosis.
No, it's not.
Okay.
The other one also.
The other one is small sized, little bit smaller in size, with
This is hypertrophy.
yeah, could be.
I'm not happy from this
Oh,
segment 6 of the liver.
okay. كمل. Let's see the rest of the abdomen.
And this is also the
يابا هذا اورال كونتراست بنتي ايش بيك؟ اورال كونتراست بالسمول باول.
comparison to the surrounding.
اي قسم من الباول بيها كونتراست قسم ما بيها فما كلها تصير فول.
Yes. This soft tissue.
زين. Let's see coronal. طبعا she has spinal fixation by the way. Few screws in the vertebra.
This soft tissue or intra-bowel lesion.
Intra-bowel soft tissue. This is not soft tissue. This is fecal material.
Fecal material? How you know this is not fecal material?
هاي مبين الفيكال ماتيريال بيها ill defined بيها gases within the lumen, soft surrounding colon, no thickening, no nothing. So it's most likely fecal material. زين. Let's go to the coronal. Maybe
This one.
Going down.
ريهان شفتيها انت مو؟ تمام. So what's going on? And again, there are two things the radiologist missed: the very small and the very large. زين. هسه هاي دقيقة شيء أو تركي.
There is a thickening of the wall,
Okay.
fast running surrounding this region.
What's this region?
This is ascending colon.
Ascending colon. Okay. Wall thickening.
Yes.
Bad. Hello.
A little will enhance the thickening and the following of the new one.
So No.
Regularity.
let's see it in the
Axial.
axial. راوينا هذا الحكي.
This is
This is what? Wall thickening, irregularity, lobulation.
outline
Okay.
of the ascending colon,
Mm-hmm.
extending from up to maybe 1/3 of the bowel
Okay.
and the
So this means what?
mass, bowel mass.
What's your diagnosis or differential
Metastasis to the
diagnosis?
liver.
Metastasis to the liver شنو؟
We see the lesion in the liver also in the segment 6.
وين الليجن؟
This
هذا جست بورتال رايد مو قلنا بورتال هاي جاي من
this
من الهايلم ورايح لجوا. تشوفين كونتراست بي شلون صاير؟
yes.
واتفقنا انه اكو سيست بالليفر، سمبل سيست هاي ما لنا علاقه. البرايمري باثولوجي شنو؟
Colon mass.
كولون ماس اللي هو شنو؟
Adenocarcinoma.
most likely carcinoma.
Yes.
Okay. So what would be your recommendation for the referring physician?
Will you correlate with the coloscopy?
You should go for colonoscopy and biopsy.
Yes.
And after biopsy, go for right hemicolectomy
Yes.
followed by
Searching.
chemo, radio, هاي الشغلات. تمام؟ So this is a case of what?
Carcinoma. Adenocarcinoma.
colon لا تقولين ادينا.
يعني ده
قولي كولون كارسينوما. كل شيء يطلع يصير يطلع على حظك سكويموس.
يمكن lymphoma because there is no bowel obstruction.
Other possibility is lymphoma.
Original lymph
صح. It is in the differential.
and they're very the wall thickness even it's more than 4 cm I think.
But
Lymphoma cause massive wall thickness.
lymphoma is in the diagnosis, but not because it's not causing obstruction. Lymphoma more common in the ileocecal region. Second, the lymph nodes should be much larger than this. Third, most of the time it is circumferential, not eccentric. Okay? Third, you might have evidence of lymphoma elsewhere, not only regional lymph nodes.
The distance.
So it's not in typical of lymphoma. It might, I don't know. Everything is possible. Might be a lymphoma. But my primary diagnosis would be colon carcinoma first, then especially the case is not presented with obstruction. Maybe it's too early. If I waited for like a week or two, she will present with bowel obstruction due to the mass. اوكي.
بالنسبه للبايوبسي يعني
مم.
لو نقدر نسوي له الترا ساوند
لويش تسوي له الترا ساوند جايدد؟ اندوسكوب وياخذونه ويطلعونه
نقدر نسوي
سيفر ايزير ماتش ليس ريسكير. مو اذا تاخذ يو بيرفوريت ذا وول وتصير تفوت بيرتونايتس واشياء ويصير فيك الليك ليش ايش لك بوجعه الراس؟ كولونوسكوبي وخلاص.
We can't put this to liver lesion as metastasis because they are too small to characterize.
They look like cysts. They look like. However, should be reported and followed up in the next CT scan to see the size. Is it changing or not? If it's changing, it's metastasis. If it's not, it's cyst.
بالنسبه للكدنيز يعني هاي
الكدني عندنا اتفقنا انه two kidneys. One is larger than the other. The left is little bit small. Both of them have multiple parapelvic or peripelvic cysts that simulate hydronephrosis. We see this a lot of times, and unfortunately a lot of times by ultrasound we report it as hydronephrosis, and the patient end up getting CT scan for absolutely nothing.
Okay, but this case has no lymph node.
شلون lymph node؟ عنده lymph node.
Paraortic.
Wait, leave it.
So,
What happened? You can see here there are lymph nodes here, and
how you know this is lymph node?
هاي اي دويره صغيره باعيه ايرتوكيبل هاي lymph node.
Intraperitoneal.
اوكي شوفي كل هاي areas of lymph node. طبعا من الدريننج من البارت هذا يعني هاي ذي see draining from here. You need to memorize their location to see it. Okay? I think we have no more time for today. Thank you very much. See you later inshallah.